Well, I'd like to take a minute now and welcome our next guest on this program, and it's really a pleasure to have her joining us. She's President and CEO of the Alliance, which is a employer coalition out of Wisconsin. Cheryl, good morning.
Good morning.
Okay. Nice to have you with us today. How are things in Wisconsin today?
It's great to be here. It's a beautiful spring day here.
It's interesting. This is our Wisconsin show, Cheryl. We just had Chad Wilkins with HSA Bank on a little while ago, and so it's the time for us to plug into the Midwest. So
yeah, we got lots going on.
There you go. Give our audience a little background on the Alliance, and then we'll talk about one of your new initiatives, QualityPath.
Sure. So the Alliance is an employer-owned cooperative. We're owned by now over 240 employers in Wisconsin, northern Illinois, and eastern Iowa. And they collectively provide health benefits for over 100,000 employees and their family members, typically on a self-funded basis. Altogether, we spend over $500 million a year on healthcare services, and we were formed in 1990, so we're celebrating our 25th anniversary this year for the mission of controlling costs, improving quality, and engaging individuals in their health.
Well, congratulations, by the way, on your 25th anniversary. That's
Thanks.
Great. Talk about this new program, which is in line with that, your QualityPath program. Tell us what you're doing there.
Yes, so we started the QualityPath initiative really to make faster progress on all three fronts of our mission: cost, quality, and consumer engagement. And in order to improve healthcare, as we see it, everyone needs to make some changes. This is really a team sport. So we created the QualityPath initiative to provide a framework for change to occur. We start with high-cost, high-stakes procedures in orthopedics and cardiology. So beginning with knee replacement, hip replacement, and cardiac bypass surgery. We are evaluating individual physicians and hospital pairs on their outcomes and on important clinical processes that, if implemented, really improve care for patients. And once we know which physicians and hospitals meet the quality threshold, then we're moving on to the negotiating phase where we are negotiating lower bundled prices coupled with warranties that protect employers and consumers against things like the cost of readmissions or complications should they occur.
Mm-hmm. How did you land on the three hip, knee, and cardiac first? How did you land on those three to begin with?
Well, we looked for things that were both high cost and high stakes to consumers, and where they really had an opportunity to shop, to make a conscious decision about where to go for care.
And as the baby boomers are becoming more, as we're all aging baby boomers, it's and we're not slowing down, we're going to need more hips and knees, I think, too, right?
That's one of the trends. The age at which people are receiving those orthopedic procedures is getting lower and lower, younger and younger.
But then you allude to you will expand from this event as you go on, right? You're going to expand.
Yes.
Good.
Yes. We're working on version 2.0 right now, where we will expand the number of procedures that are involved in the QualityPath initiative.
Okay. Did you work with? Go ahead, Cheryl. I'm sorry. Didn't mean to interrupt.
I was just going to explain one other component that's important to note about the program. This is voluntary. So the physicians and hospitals that are part of the program voluntarily agreed to participate and to meet the quality standards and to agree to the bundled price. It's also voluntary from the perspective of employers. So our members can access that bundled pricing and the warranties only if they implement substantial steerage in their benefit plan design. So that's the change that we're looking for employers to make, to create, for many employers for the first time, incentives for their employees to go where care is high quality and where costs are controlled.
Yeah. So you're really stimulating the whole team support concept, getting all involved in changing up the way they do things.
Well, we getting the magnitude of change that we need to achieve in healthcare really requires everyone to do something different.
Yeah, I couldn't agree with you more. Did you? Go ahead, Cheryl.
Yep, go ahead.
Did you collaborate with any specific group to help develop the quality and process criteria?
Well, this was also the process to establish the quality criteria was very broad-based and collaborative. So, for starters, we worked with a physician, Dr. Gail Amundsen, who provided clinical leadership for this project. And with Gail on board, we reached out to the hospitals and the physicians that deliver the care, so orthopedic surgeons and cardiothoracic surgeons, as well as their specialty societies at the state and national level, to get their input on important elements of quality. We wanted to understand what, from their perspective, we should be looking at to discern high-performing physicians and hospitals. And we also got input from national leaders in healthcare quality, such as Dr. John Santa from the Consumer Health Choices at Consumer Reports, and also Dr. Karen Sapuka from the Director of Health Decision Sciences at Massachusetts General.
Oh, outstanding. How does talk about the patient experience? How does QualityPath change that patient's experience?
Well, patients who go through the QualityPath program, we think, will have several big advantages. First, they'll have greater peace of mind that the physicians and hospitals in the program have gone through a significant vetting process. So their chances of getting a good outcome are improved. And they'll be protected by a warranty against defects, complications, and readmissions. They'll also pay less, and typically this means nothing at all. They'll pay zero because their employer has agreed to cover the cost in full, no copays or deductibles.
Wow,
and
okay.
They'll also have the benefit of a patient experience manager, an employee of the Alliance, who will guide them through the process, answering questions, ensuring that they have the best possible experience.
So what is, when you look at the program now, how is the level of participation and the outcome? I mean, how do you, from the employer, taking on this initiative, how are you working to help persuade them to come on board, and then all the way through to, the employees and the patients? How's this all working to date?
Well, it's early. The program just went live on January 1, but so far we're very encouraged by the participation and support. And it's really not a surprise. This program is designed to meet important employer goals related to getting good quality care for employees while controlling costs. So it's kind of a win-win-win. And there's not a lot of convincing that's needed.
Yeah. So that's your front side persuasion, so to speak, to get the employers to buy in. Now, do you work with them to help them sell it on to their employees and family members?
Yes. We recognize that getting employers enrolled is an important step, but it's not where we need to be completely. We have to be able to educate employees and their family members about the program and its benefits and the value of using QualityPath designated providers. So we've developed a lot of support materials that employers can use to educate their employees, things like newsletter and web content, videos, etc. And we're also doing outreach to employees directly ourselves.
You are chair of the National Business Coalition on Health, correct?
That's correct.
Have you? I would imagine you've got some of your coalition members that are very interested in what you're doing here with QualityPath.
Yeah, this is a relatively new initiative for business coalitions. Certainly, we have other coalitions who have taken a more national approach and identified centers of excellence around the country. This is really designed to change healthcare right here where we live and work, and so we will be sharing the QualityPath program at an upcoming NBCH meeting.
Oh, that's great. At the November annual meeting or one before that?
This we're going to be sharing this at the all-member meeting, which is just the coalitions, in June.
Oh, June. Okay, great. When is that? When's that meeting in June?
Well, I'd have to quick look at my calendar, but
no, it's okay. I was just speaking to Brian this week, so.
Yeah, it's, I'll look here quick. This is just for NBCH members, and it's June 10th.
June 10th, that's great. Well, I appreciate that. I didn't mean to digress there, but I can imagine the membership being excited about learning this as well as you guys learning about what others are doing in innovative ways too, because it is, that's the team support too. That's one thing we believe in is collaboration, bringing all stakeholders together to share what everyone's doing to build best or better practices, because there's not one great idea. There's a lot of great ideas that come together to form much better ideas. What else do you want to tell us about QualityPath? Like, you started to talk about version 2.0. I mean, it is early. I didn't realize you just rolled it out January 1. So where does it go from here, and where do you want it to end up? Where do you want it? What's kind of the end goal?
Well, so the end goal is really driving better value healthcare. And I think the thing that is most impressive to us is that we're already seeing signs of progress. The physicians and hospitals that have been designated under this program have really stepped up to meet a high bar and have implemented important clinical processes and are doing well on outcomes. So, we're impressed already by the level of change that we're seeing. And I can give you some examples. One of the criteria has to do with participating in national registries. So for cardiology, that is the Society for Thoracic Surgeon Registry. For orthopedic care, it's the American Joint Replacement Registry. And physicians and hospitals have to be submitting their clinical data, and they have to score well on the quality measures that are derived from those registries. We have seen, in fact, we've heard this from the American Joint Replacement Registry, the question, what's happening in Wisconsin? They're getting a lot of interest from Wisconsin hospitals and physicians to sign on to the registry. That's great news because it's foundational to being able to not only measure but improve the quality of care that gets delivered. Another one of the key,
Go ahead. That's fine.
Another one of the key criteria has to do with appropriate use of imaging, and we are requiring that hospitals and physicians implement systems that give physicians the evidence at the point where they are ordering a test for a patient about the level of utility or appropriateness of a particular imaging test. And this will go a long way toward avoiding inappropriate use of high-tech imaging, which most importantly is exposing people to unnecessary radiation, but also is driving up costs without adding value.
Yeah, that's what I'm saying. Let's show it. I really appreciate you joining this program today and sharing this with us. It's been very insightful and interesting, and we'd like to really stay abreast of how this program continues to evolve. I want to give you a chance to leave our audience with 2 or 3 takeaways, please.
Well, I think first and foremost, it's important for purchasers and consumers to be clear about what it is that they want to buy from healthcare providers. What are the quality standards that are important to them, and to communicate those clearly, because we're seeing the market will respond. A second thing is that you can work together, employers and other purchasers can work together in a community to move healthcare forward. And that it's important to be focusing on a regional level so that we're driving better quality for the community right here where we live and work.
Outstanding. Cheryl, if somebody wants to follow what the Alliance is doing, what's your website address, please?
It is www.alliancehealthcoop.org.
Thank you so much, Cheryl. Listen, I really appreciate the time today. It's great content, great discussion. You have a great weekend, and we'll talk to you soon.
Thank you.
Thank you, Cheryl.